I'm very pleased to announce our next speaker, Maneesh Juneja, who is both the Digital Health Futurist and the Health 2.0 London chapter founder, former leader and now the founder. Welcome, and we look forward to your talk, Maneesh. I need to sit here. Morning.
By the way, I'm going to hopefully keep you awake during my talk. It's going to be a little bit interactive, so hope you've had your coffee. So just a quick disclosure, I'm going to be talking about a lot of companies and products this morning. I've got no commercial ties to any of them. I'm completely... microphone!
We're using microphone 6. Microphone 6.
Hello? That's just me talking to myself. Oh, there. We're live. Yeah. Hello? So I've got no commercial... Is this on?
Yes, we hear you.
I've got no commercial ties to any of the company's products mentioned this morning in my talk. And just before I get into this conversation, I've got enormous respect for the doctors who work so hard to save lives. Now, we heard yesterday about aging, and I believe as well that in the 21st century, the biggest challenge facing this world is aging. At the moment, the number of people on this planet aged 60 or above is greater than the number of people aged 5 or under. By 2050, that's set to become, the people over 60 will be greater than the people under 15. Governments are not taking this seriously until now. So just a few months ago in London, the G8 hosted their first ever dementia summit. So again, they're starting to take this seriously. When it comes to the cost of healthcare, it's ludicrously expensive and it's unsustainable. If you look at the, every person I speak to in healthcare is faced with budget cuts. They're being asked to innovate, but then the money is less. And so to give you a statistic there, by 2050, it's estimated that in most countries in the world, healthcare spending will have doubled from today's levels. That's just absolutely extraordinary. When it comes to the practice of healthcare, it's extremely complex, regulated environment. If you look at the US, the third leading cause of death every year in the US after heart disease and cancer is medical error. If you look at this example here, why are we still using paper in hospitals? Why are we having faxes being sent when we send emails to each other? Why does it take a week or two to book an appointment to see your GP? Why does it take a couple of weeks or longer to get your blood test results? Why can't we use technology to prevent people from getting sick? So there are actually people talking about this now. So it's just in the last 2 years, you've got this guy here, Dr. Eric Topol. He's based in San Diego. He's written this book, The Creative Destruction of Medicine. Very interesting, triggering a lot of debates. Then you've got this guy, Vinod Khosla, who's an investor. He was the co-founder of Sun Microsystems in Silicon Valley. He's talking about that we need doctors or algorithms. He made a very provocative comment in August 2012. A lot of angry responses from the medical community based upon what he was saying. Now, do we have enough doctors in the world today? Now, if you look at where we are, for example, in the UK, that's the number of doctors per 1,000 population right there, just under 2.8. You look at the USA, 2.4. But then you look at other countries, say developed countries, 3.7 for Germany. You look at India, though, less than 1 doctor per 1,000 population. China's a bit better. Look at Ghana. Look at Nigeria, which has got a huge population. Look at their ratio. Look at Brazil. Look at even at South Africa, which is probably the richest country in Africa. So that's quite staggering when you think about it in terms of the driver of why we need these advancing technologies. Question for you in the audience today. How many doctors and nurses are we short of at a global level? Is it 500,000, a million, 4 million, 10 million? 10 million?
4 million.
Okay. 100 million, that's not up there. It's actually, according to the WHO, it's 4.3 million. That's the global shortage right now. Now, how many people on Earth don't have physical access to a hospital, clinic, or doctor of any kind today? Any guesses?
Over 1 billion.
Over 1 billion? Any more? Lower? Higher? It's actually 1 billion. But it's absolutely staggering in terms of, again, we sit here in a country where we have a reasonable standard of doctors to patients in the population, and yet there's 1 billion people that don't have that access. Now, I was talking to Phyllis Frosch, who's a friend of mine, Personalised Medicine Coalition in the States, very, very insightful thinker about the future. So she sent me this slide, and we were talking about actually, you know, the practice of medicine through the ages and how nothing much has changed in terms of the practice of medicine there when you have the doctor visiting the patient. When you're sick, you ask them to visit you or you go and visit them. You look in 2025, what she's talking about, given genomics and personalized medicine, where we're heading, is that at the right time, the right treatment will be delivered to you based upon all that data that's going to be generated about you. So again, what is the role then of the doctor in that future scenario? If they're going to be sitting there monitoring what's going on with your body. Now, what do naturopaths say about doctors? I found a quote many years ago. I don't remember which person said it, but he wrote down, the ultimate aim of every doctor should be to become unemployed.
Like in China.
Exactly. So
Yeah.
you look at ancient China, and I found it fascinating to see that actually in ancient China, the model used to be that the doctor in the village would get paid each month, provided none of his patients got sick. They were operating on this model, so it was all about prevention. Now, when it comes to wearable technology, which is in vogue at the moment, so last week I went to the Wearable Technology Show, first ever in the UK. So I met this young man. He's from that little country there, Bulgaria, in Eastern Europe. And they've developed a prototype of an insole for your shoe with these pressure sensors that in real time is going to send stream data to an app on your phone that tells you where on your foot, on the left foot and the right foot, you're putting pressure and monitoring that. So again, they've designed it from a sports perspective for runners, but I asked him, what about if you could use it for older people? What if you could use that data to predict when an older person is at risk of falling because the pressure's changing on their foot? Now, why is that important from a healthcare perspective in this country? 40% of the ambulances called out to the homes of over 65s are due to falls. So think about it. That guy in Bulgaria is working on that and the impact of that technology. So again, a lot of the technologies I see are going to come from outside the traditional sources. Look at this. I picked this up off the internet. I thought it's fascinating. If you look at wearable technology at the moment, that's where we're heading. If you've ever used any of these devices, you need so many. Again, is that something we want to head towards? How's technology going to serve us rather than the other way around? So I talked about that startup from Bulgaria. I've spent the last 2 years running the Health 2.0 London chapter, stimulating the growth of startups in digital health in this country. Absolutely fascinating to see the energy and the spirit of these people, some of whom know nothing about healthcare, but they're frustrated through their own experience, their relatives' experiences, and they want to do something. And I believe we need to do more to stimulate startups in this area, not just here, but globally. Internet of Things is going to be a buzzword you're going to hear more about, where everything's connected. Estimates vary. Cisco's internal research says 50 billion devices connected to the internet by 2020. Here's an example, a vending machine, and I've met some people who are working on a prototype of this. So you approach your smart vending machine in the future. It knows that you've got high cholesterol. It knows that you haven't walked much. It knows you haven't slept that much. You go to select a chocolate bar and a fizzy drink. And the vending machine, because it's got AI and the Internet of Things, actually says, hey, don't you think you should have a coconut water and a granola bar? How do you feel about machines knowing more about the state of your health than you, or even your doctor? This lady here is an amazing lady. She runs the Body Computing Conference every year at University of Southern California, Dr. Leslie Saxon. She spoke at South by Southwest in Austin recently. She talks about a future within 5 years of electronic tattoos being put on the chest of every newborn baby in the developed world. And that can monitor in real time EKG, all the biometrics, and stream that data to an app on a device that both the pediatrician and the child's parents can just monitor. Now, when I think about even further than that, does that mean if this actually happens, does this mean that we move from wearables to tearables, that these electronic tattoos are almost disposable, they're like plasters? This is a dumb toilet, but we're talking about a future which involves smart toilets. This is plausible, actually. People are working on this right now, given the Internet of Things. So imagine again this scenario. You wake up in the morning, you go to the bathroom, use a toilet. It's a smart toilet. It analyzes your health. You then walk towards the kitchen and your smart fridge is connected to the smart toilet and your smart fridge knows what you've got in there and what's left. By the time you get to the breakfast table, the app on your smartphone is linked to the data from your smart fridge and smart toilet, and it gives you a personalized meal suggestion for the day. What do you feel? Does that make you excited? Does that make you scared? Now, Intel did a survey across 8 countries, including India and Japan and Indonesia, but they asked what percentage of people would be willing to share data from their smart toilet if it could improve healthcare. Was it 5%, 16%, 34%, 58%, or 70%?
70? I don't know. 70.
70%.
Yeah, because we want to know.
And you know the country that they surveyed where people were most willing to share information about their bodies if it could improve healthcare and innovation in healthcare? It was India.
Really?
So again, our attitudes towards privacy here differ from other countries. Now, when it comes to data, the heart of this revolution in healthcare is going to be data. In particular, the data from each of us, our bodies. 24 hours a day, our bodies generate data. It's not captured unless we visit the doctor. But with these new technologies, we're talking about data that we can capture on ourselves every day. Now, many people are interested in this data. It's extremely valuable. Not just scientists looking to find a cure for disease, health insurers, governments, even cyber criminals are interested in this. So these are companies that down below that are recently set up in the last year or two because there's a new trend of actually people waking up and saying, how much is my data worth? Who owns my data? Who has access to it? DataCoop is a startup in New York building the world's first personal data marketplace. It's not specifically designed for health data, it's any personal data. You can sell your Facebook data directly to a brand, get paid for it. Handshake is a UK startup trying to do that. You've got Health Bank and our Health Data Cooperative, which are talking about patient data cooperatives, where you can actually store your data in a patient data cooperative where you know you own that data about yourself, you control who accesses it, and you get financially rewarded for sharing that data. And then there's Citizen Me, which is a UK startup, and they're building a platform again where you take control of your digital identity. Now, robotic surgery. So at the moment, top left-hand corner is Da Vinci robotic surgery. What it's designed to do is basically to minimally invasive surgery. So it's not the surgeon making direct contact with the patient anymore, but it's via this robot. Then you've got actually, in terms of innovation, you've got DLR, which is based in Germany. They're looking at robotic surgery which can actually be conducted remotely. So, and what they're planning for is that in terms of people going into space who need surgery, to be doing it remotely from Earth. Now that's what they're working on. And this is a great video just released about a month ago from Ido Bachelet on surgical nanorobotics, where they're talking about actually what if you could eliminate the need for surgery. One drop of saline injected with nanorobotics that actually repair whatever they need to repair in the human body. It's a 10-minute video, absolutely staggering.
Is it on YouTube?
Yes. Yeah, you can just search for it. That's taken from YouTube. And then you've got then personal care robots. So, for example, in Japan, where they've got one of the top countries in terms of aging population, they're looking very much at robots to help deal with their older population. Whether it's personal care in terms of even lifting that older person out of a chair into the bath. Now, 3D printing of human organs is a hot topic, lots of excitement about it. This is just something I picked up off the internet where somebody, futurist, he put down, okay, 3D printing of human hearts in 10 years' time. Interesting. Not going to happen. Human heart is incredibly complex. We're not there yet. The leading company in the world is Organova, based in the States. At the moment, where they're at, and they're the leading people in this field, is they can prepare strips of liver tissue that they can sell to pharmaceutical companies that can be used to test the toxicity of potential treatments. That's where they're at today and at the leading edge. 2019, possibly, printing those tissue strips to patch failing organs.
Excuse me, is Organova a 3D printing company?
Yes. Yes, 3D bioprinting. And then 2025, perhaps printing of simple organs, but the heart, not likely within 2025. The main challenges to actually printing those human organs is actually creating the blood supply. So creating the living tissue with the stem cells is one thing, actually creating a blood supply is another thing altogether. Now, this has just come out a few days ago, IBM's Watson, which is famous for a supercomputer AI that has beat humans at Jeopardy, that game in the US. Now, what they're working on, current research, is that actually, if you're talking about personalized medicine and genomic data, it's so difficult to look through that data by human beings, they're planning to use Watson to try and comb through that data. Now, again, this is just research, but it shows how quickly the times are evolving. Now, there's a lot of hype, especially if you read a lot of the tech magazines on the internet. Now, what I believe in is science-driven innovation when it comes to healthcare. This is me last summer on a nice sunny day in Los Angeles at the Body Computing Conference. That guy there is Dr. Dave Albert, a cardiologist who's invented the AliveCore device, which is an iPhone case that can do an ECG. It's FDA approved, over the counter now. So you can actually then now, they've just added that you can actually, after you take your ECG anywhere with your phone, you can then get analysis done, clinical, by a cardiologist within 24 hours, $8. Now, when I talk to him and I say, what about that electronic tattoo, Dr. Dave Albert? Is that possible? I always go to him for advice, and he tells me the truth always. He says, Maneesh, the big challenge with those electronic tattoos, they sound great, but actually the major engineering challenge is power source. You're going to stick it on the skin. How are you going to power that? And second, the signal to noise ratio. How are you going to filter that data coming from your body versus all the other data that's being generated by your body? You speak to doctors. Main challenges, they always say, Maneesh, we've got evidence-based medicine. You're showing me all these digital health startups and all these cool technologies. Where's the evidence in digital health? And at the moment, there is hardly any. But startups are saying, we've got this cool product, it potentially can do this. It's a major barrier to getting these physicians to adopt these new technologies. You may have heard that Google were using the search queries for people searching for flu to be able to predict when the next flu pandemic will come along. So again, a recent article, and I like the term that they used in this article, automated arrogance, because actually there's a failing from not big data, but Google's use of big data that actually they found now retrospectively, there was a study that actually found that Google were overestimating the prevalence of flu based upon this Google Flu Trends project. This is an interesting thing. I was at a workshop in Nesta in London last week. They invited me to talk about personal data, wearables, and the future in terms of, so the scenario was that in 10 years in the future, if people are paid for sharing their health data, could it be even possible that people use wearable technology to falsify their health data, because it's economically valuable to share your data? Will people even give themselves a chronic disease using wearable technology just so they can get money from a pharmaceutical company? Sounds absolutely crazy, but again, I'm glad that we're having the debate now. Now, we've got this road ahead. The biggest question on this road ahead that a lot of people ignore is who's going to pay for all of this? You speak to the NHS today, anyone, they're not even having to do more with less, they're having to do less with less.
Aren't they savings in that? Isn't the whole point of this is savings?
No, because actually some people feel that actually by investing in these new technologies, you can create, these new services can create new demand. Now, PwC did a survey 2 years ago globally. They asked doctors in different countries about mobile health, M-health. What they found was that 64% of doctors are resistant to M-health technology. Why? Because it will make patients too independent. It's going to shift. This technology, if it comes around, the real battle is because for centuries, doctors have had power, profit, and prestige. And now you're talking about technology taking that away from them. So in terms of how do we actually collaborate? How do we get these new technologies in society? How do we get them to patients? How do we get doctors to adopt them? You know, we need to start, rather than thinking of, you know, rather than going down this I lose, you win, or I win, you lose, adversarial mentality, or a lose-lose if nobody wants to do anything, how can we actually as a society get to a win-win scenario? How can we get everyone around the table talking about this now, having open and candid conversations? Now, this is in terms of will advancing technology make doctors unemployed? These are researchers at the University of Oxford. They've 6 months ago they did this research and produced this mathematical model based upon data from the US in 2010. What jobs in the next 2 decades are likely to be computerized and the probability. So you can see here that actually the job that's most likely to be automated in the next 20 years is a loan officer at a bank. It'll just go through an algorithm. According to these guys, their research, they're saying actually physicians and surgeons, 0.4% chance of their jobs being computerized. So they don't believe that doctors will be unemployed. However, within healthcare, they're saying, you know, those low-level jobs, which don't require much skill, medical secretaries, medical record technicians, they'll probably disappear within the next 20 years. By the way, for those of you in the audience who are computer programmers, I point out the fact that they believe there's a 48% chance of your job being eliminated in the next 20 years. So time to actually become a choreographer. Now, this is a slide I made up because I just envisioned this future then. With all this technology, everything converging together, are we going to be sitting there in 2025? We have a fever. Hey Siri, why do I have a fever? Checking, 1 minute. Oh, you've got lung cancer. Oh, it's terminal. There are 3 end-of-life care facilities near you. Would you like directions? Oh, by the way, you haven't made a will. Would you like to make one now? Now, if we go down that road, is the role of doctors almost just that they're morphing into data detectives? That's the skill that they need. And then also, if you think about it, what I've been thinking about is actually if all this comes true and we go down this road, What is the role then of the human being in healthcare? And actually, what machines and technology and software and data can't do is provide hope, is provide compassion. So you do get Siri to diagnose you, but actually you need a human being to hold your hand and tell you, I'll be there with you till the end. Eye contact, human touch. I don't believe that can be replaced. That's the role of doctors in the future, possibly. But then, why do we need to pay them so much if all they need to do is hold your hand? Not forgetting that actually the reason for pushing this advancing technology is that these people like this, part of those billion people who have no access to any healthcare facilities, we've got to remember these people and not just think about people here in the developed world that have access. Oops. And very quickly summing up, the reason at the moment, the challenge is there's no profit in prevention. We have to move away from these perverse incentives where doctors, especially when I talk to them in the USA, as soon as a patient walks in through the door, my first thought is, how much money can I make from this interaction? How many tests can I order? How many procedures can I order? How can I upcode the diagnosis so I get a higher reimbursement rate? That, to me, is perverse. Technology, though, may enable us to shift away from that. There's lots of questions, lots of uncertainty. We can't, like we said earlier yesterday, we can't predict what's going to happen in 2025. However, what we can do as a world is ask ourselves, where do we want to go? Thank you.
We have a few minutes for questions. Okay, first here. Second, third, fourth. Okay.
Two quick questions. One is there's two trends going on. One is that automation is increasing unemployment, and the other is that as the price of different technologies decrease, we get more purchasing power per unit of currency. It seems like there will not be enough jobs to all the people in the world in the 2020s and 30s. You mentioned selling our data because there's a lot of initiatives about a universal basic income provided by a government, but it seems to be a very slow and difficult process to provide a certain life right of money for each individual in the world. So is there any way that we could achieve kind of a universal basic income through big data from companies, for instance?
Absolutely. So I gave a talk a year ago in which I envisioned a scenario that actually we've got 7 billion people, 7 billion mobile phones. We have the fact that technology that potentially allows us to collect data on each of these individuals, and there are companies out there, organizations wishing to get that data. So what if we could build that platform that at the same time as enabling those people in rich countries to do that research and get their data, you can potentially improve the standard of living by actually paying people around the world for their data, even rural Africa, for example. So I think that's entirely possible.
Thank you. Over here, yes.
Hey Maneesh, that was great. Just a question with regards to using technology to help solve short-term issues. And I think the NHS quoted that they'll have 20 billion shortfall.
30 billion.
30 billion by 2020. So how realistically do you see this helping in the more shorter term?
It's not. And I'll tell you why. So you may have the leaders of the NHS and healthcare organizations who say, we want innovation, we need to do this. They understand that it's not sustainable, this practice of healthcare. But you speak at a local level, you go to the procurement team in your local area, and I've had startups say, okay, we finally got an introduction to somebody in the NHS, they liked our technology, they liked the business model. When it came to dealing with procurement say, oh, right, so our due diligence rules say you need 3 years of trading history. Do you? Oh, no, we're a startup, we're 3 months old. Oh, sorry, bye-bye. That's the harsh reality on the ground.
Yes, question here.
Why is it that doctors, surgeries and hospitals are still using pen and paper and faxing these forms rather than using a digital medium?
That's a very good question. Because they haven't been incentivized to make that switch. And again, so in the US, with Obamacare, they've recently introduced a package that stimulates doctors to move away from paper to electronic medical record because they will be penalized if they don't.
One last question.
Hi. So my day job is investing in healthcare businesses in India and Africa. 2 questions. First is, given sort of the ideas that increasing productivity might make doctors unemployed, India is embarking right now on a massive expansion of medical universities. Would you tell them not to? Second question is, the track record of medical innovation over the last 30, 40 years has been largely one of increasing cost. Do you see any change in that trend? Because all I see is technology increasing health inequalities in places like India and Africa rather than sort of providing for the billion people that you talked about.
Okay, so thank you. So in terms of the first question, would I advise the Indian government to not build those medical universities for training doctors in India? I wouldn't say per se they should stop, but they should incorporate into their plan what the role of these new technologies might be, how plausible they are. When it comes to your second question about the increasing costs of medical innovations and developments, the biggest area for disruption where it's going to be easiest to make changes and introduce low-cost technologies is in the preventative medicine area. So again, all the diagnostics, tracking our data again. I see a lot of innovation coming from startups in poorer countries. And so actually Western countries are now having to consider how can they import some of these technologies, reverse innovation, into Western healthcare systems if they're going to have a sustainable healthcare system.
Thank you.
Thank you.